how does your work support the overall well-being and health of Black communities?
We launched Black Health Matters in 2012, and the impetus for it was the advent of the Affordable Care Act. So I don't know about everyone's personal history, but I lost my grandparents too soon. I don't believe my grandparents lived to see the age of 70. And so by the time I remember I was a teenager, by the time my grandmother was admitted to the hospital, she probably didn't live another week. And I know that her death was overwhelmingly painful. There was no peace because, there was no such thing really as Black folks really going into hospice. And I remember thinking, well, if my parents knew better, they could have done better for my grandmother. If I had known better, I could have done better for her. But at that time, people were not challenging doctors to the degree that we feel that we can now. And people really just, people didn't want to present or talk about their illness. They basically suffered and then dropped dead. So then I felt that I would not want other families to have to experience that. When the ACA was passed, I was really excited because I felt that this was a great moment for African Americans in the sense that we would now have access to care. We could have a mammogram. We could have an osteoporosis screening. We could go see a doctor. It wouldn't have to cost us a fortune. We can search and find a program out there for every kind of budget. All of that is great. Access is great. But unless you have an understanding of what the fundamentals of health are, it doesn't matter how much access you have. Have you ever met people, they don't understand that they're supposed to have vegetables, they're supposed to have fruit, they're supposed to sleep at least 7 to 8 hours a day. You're supposed to manage your stress, good oral hygiene. All of these things will go a long way in helping you live a better and longer life. But unless you have a roadmap or a blueprint for that, access isn't going to help you. And so we launched Black Health Matters to be the North Star for thousands of African Americans who would embark upon their journey to better health. We launched with a website. And so we built a lot of content that was self-reflective, meaning we talk about elements of the diaspora, right? We talked about the foods that we ate. We talked about our lifestyle, and we promoted that. And then we went into social media because that's a great way to also amplify the content that was created. And what we found when we first started more than 8 years ago was that we would kind of plant ourselves in various social media groups, right? So Black women have a lot of conversations about natural hair online, a lot. We spend a lot of money on hair care products. So we would kind of creep into a social group on Facebook, and they would be talking about natural hair. And we'd be like, oh, if you ran and worked up your cardiovascular system, you'd have more blood flowing and it would help your heart and could possibly help your hair. That was an angle. We were desperate, but we needed to get our name out there. And what we found was that people would report us to Facebook and Facebook would shut us down. So if you can imagine trying to launch a brand and not having a voice, because people were like, we don't want to read about that. What did they say? I ain't got time for all that. I just want to read about my hair. Fast forward to today, we can go into any chat room, any Facebook group with content that's relevant for that group, and it is accepted, liked, and shared. So we have been at the beginning kind of this evolution where we're now very conscious that Black health matters and that we need to be proactive and that we can advance our own health and that of our families. And that is the work of that is my advocacy. We launched something about 2.5 years ago, which are the Black Health Matters Summits. And the idea with that is that we all understand that we love entertainment, right? Our culture has helped us to produce amazing entertainers, music, rhythm, art, culture. That's what we do, and we do it so incredibly well. So what we decided was that we were going to create symposia for the grassroots that would somewhat mirror we call it the BET Awards of Health, right? It's slick, it's well produced, it's information, but it's with clinicians that drop the mic. We call them the hardest working docs in the business. They have passion for what they do. So when I would go for conferences, prior to launching the summits, I would just be amazed that some of these scientists could talk about a molecule and make you cry, the ones that are really involved and excited about it. If I said, if I could just share that level of excitement with the African American community, they also might get hyped up about this and start to think about, well, if I've got cancer, I'm going to demand better care, or I'm going to ask about this molecule, or I'm going to seek better health, or we wanted to elevate rare diseases that impact our community. 1 in every 222 women that are African American have lupus. What are we doing for them? Let's talk about sickle cell. So we created the summits to give oxygen to the disease states that just don't get any kind of play in general media. And our summits were successful. So we start from 8 o'clock in the morning, we go into 5, we cover 15 different types of sessions and chronic disease, everything from Alzheimer's to HATTR amyloidosis to a variety of different disease states. And we come together to build a culture of health and to destigmatize illness. We're also reaching out to brothers because we're tired of Black women being the chief medical officer of their families, right? Brothers need to step up, but they tend to be a little more stoic. So we are hosting our next event at the Kappa Alpha Psi fraternity, and that's going to be on July 13th. All of our summits are always free and open to the public. And so we are going to dialogue on why Black men need to get involved in their own health, because 1 in 8 will have prostate cancer. It may not kill them, but 1 in 8 will have it. So they need to know what to do, where to go, and how to proceed. So we're looking to build, again, a community of health, a culture of health that spans across the diaspora.